Healthy in your own skin.
In previous episodes, we discussed the basics of asthma. We then moved on to asthma attacks and what to do if you or someone you know is experiencing one. We're excited now to present our third webinar in the series.
Vin says I'm not allowed to drink coffee while we do this.
No.
So I need to drink this before we start.
But where's our action board?
Right, okay.
Action!
That was so quick!
Welcome everyone again. I'm Dr. Deer.
I'm Saira.
Hello. So welcome to our third webinar of the series, and today we're going to be discussing
Mould.
So that's
very interesting topic.
Exciting topic, yeah. And we're going to be discussing how mould can actually affect asthma. So let's go on to the first question.
What is mould? Because I thought it's just that stuff that goes off on fruit. I didn't realise you get it in your house.
Yeah, so mould is a type of fungus, and it's something that produces spores, and the spores we can breathe in. The mould itself can grow on damp surfaces around the house, and I don't know if you've seen it before, but you can get either white, black or greenish patches appearing sometimes on walls.
Quite smelly as well, isn't it?
Yeah, so it can have a musty, damp smell to it. So yeah, we'll get up a picture as you're lucky enough to never have experienced.
No, I have. I'm gonna tell you what happened when I experienced damp as a kid. It's all my childhood stories are coming out in these sessions.
Okay.
But before we get into that, it can be quite dangerous, can't it?
Yeah. So asthma, if you've got an allergy to the mould spores itself, it can cause a triggering of your asthma symptoms. Those we covered in webinar 1 and 2. So do you remember the asthma symptoms?
So like wheezing, tightness of the chest, coughing.
Yeah, exactly. So, and it can trigger asthma flare-up or an asthma attack as well.
Very dangerous. I think it's quite interesting actually, because you wouldn't eat something that had fungus and mold growing on it, whereas actually when you have it in your house, you just think, oh, okay, it's just there. You don't think of it as a dangerous thing. Okay, so what do we do if we have damp or mold in the house? Okay,
well, it depends where exactly it is. If it's on an item that's removable, so maybe carpets or curtains, ideally you want to replace those items. If you've got a little bit of damp or mould on a wall, so what you want to do is try and remove it so you can scrub it using detergent and water.
You have to be a bit careful though, don't you? Because sometimes that could trigger your asthma using detergent.
Exactly.
So maybe tell someone who doesn't have asthma to clean it up for you if they're nice enough.
Exactly. And also dry the walls after you've done it.
Oh yes, very important, because that's what causes mould, doesn't it? All
exactly.
That water. Okay.
Yeah. And also it's important to discuss prevention of damp and mould in the house in the first place.
Oh, okay. So what causes mould?
So, well, dampness causes, dampness, warm environment can actually, and lack of kind of air circulating can cause mould to develop. But to try and prevent it, we can reduce the humidity of the house. So
how do we do that, Dr. Deer? So
it depends. If you've got a particularly humid house, so one of the tools we can use to check the humidity of the house is a hygrometer. Oh,
yes,
hygrometer. Yeah, very good.
Okay.
So it's a device that can tell you what the humidity levels are.
Okay.
Ideally, we want to aim for below 50%. And if it's above 50%, some people find a dehumidifier helpful.
A dehumidifier, so not a humidifier, a dehumidifier.
Exactly. Yeah, a dehumidifier.
Okay. All right. There's two different things.
They're very different things. So a humidifier would be increasing the humidity, which of course we're trying to avoid in the first place. But a dehumidifier removes the humidity, and often it's a large device, and you'll notice the water filling up in it as it removes the water from the air.
If you've ever used one of these, because I've used one of these at home, and I have a very small room, and I've used it in my room, and you'll actually be quite surprised with the amount of water you get in there.
Yeah.
So where does that water come from?
It's coming from the air. It's all there. Okay. And some of these dehumidifiers also have HEPA filters, which can remove some of the dust and allergens and things from the environment.
We have one in the practice
A
filter.
big device.
Very big filter, but it's meant to purify the air. Is that right?
Yeah, and it helps to remove some of the allergens. What that device won't do is actually remove the humidity. So that's purely a air purifier. If that's something that interests you, you might want to look a bit more into the evidence. For some people it helps, some people it might not help.
Can I ask a question? Are there certain places in the house where it could be worse?
Yeah, of course. So if you think about areas where you're producing condensation, i.e.
when you're cooking
yes,
and showering.
Exactly, yeah. So when you're cooking or showering, it's important that, firstly you open a window.
Yep.
Secondly, you want to keep a door closed as well so that the condensation doesn't escape.
If you're having a shower, please close the door.
Yes. But yeah, the condensation can come out, go into other rooms.
Right, okay.
By keeping a window open, you're allowing air circulation, you're allowing the condensation to escape the room as well.
You also have those, what are they called?
The exhaust fans,
yes,
extractor fans.
Extractor fans. And what's the other one that you have? That's the vent and
you have air vents.
Air vents in the bathroom and stuff.
And modern windows now come with air vents built into them as well.
It can get cold though.
That's true.
But we'll take the hit.
Yes. That's an interesting point because when we were discussing asthma previously, we mentioned that
was a trigger.
Cold might be a trigger, and it is winter at the moment. So that's another thing to bear in mind. But, you do have to weigh up the pros and cons. But
the struggles of someone who has asthma, honestly.
Hopefully you're having warm showers.
Yeah, but then when you leave the window open and then you come out, that's, But I know, you're right. I mean, shall I tell you actually one of the tips that I do? So I find I'm cold all the time. What I do is I open the window in my room when I know I'm not going to be there.
Okay,
so like if I know, I'm not going to be there, I'll leave it open and I'll come back and that's enough air in the room hopefully for that time. It's top tip.
Yes, yeah. Good tip there. Also, it's good to keep the base temperature of your house. It says at least 15 degrees or higher. I think that's pretty cold.
Wear extra socks, wear extra jumpers. You know what? One of my friends, I went to a house and she has those, the smart meters and it tells you what the temperature and stuff of the house is.
Yeah.
And she wouldn't let it go more than, I think it was 19.
Okay.
Wow. I think it was 19, but you couldn't so we sat there with our jackets on for a while.
Did she tell you why?
I don't think it was for the damp. I think she was just trying to save money. But
okay.
I mean, yeah.
Well,
so you can do it.
Reason.
So yeah.
So it is possible.
Yes.
Okay. And any other top tips for helping prevent or remove mould?
Well, I think the important thing is actually getting to the root cause of the problem.
Exactly.
Isn't that right? Yeah.
Yeah. So try and find out what's causing it. So is it a leaky pipe? Is it a plumbing issue? If you are unsure, always get a professional involved. If there's kind of leaky pipes and things behind walls, then that can actually cause mould growth from behind the walls as well. So it's very important you get a specialist. If you've got any housing officer, to report it to them if there is a significant damp problem.
We should be reporting things like damp, shouldn't we, with landlords or the council?
Yes.
Because it's quite, as we mentioned, it's quite dangerous. It can affect your health. So it's definitely something that they should be sorting out for you.
You read a recent news article about...
It was a pretty old article. I think it was about a year ago. There was a 2-year-old baby who actually... 2-year-old child who unfortunately passed away. And this was due to having damp and mould in the house. And actually the parents had reported this. So this was something written in The Guardian, I think it was in Rochdale. So yeah, they reported it to their landlord. Unfortunately, they didn't sort out the problem. And when they did a post-mortem, they found out the child had respiratory problems, and damp and mould was, cause. So it is very dangerous.
Very sad.
Really sad, yeah.
Yeah,
it's really important.
So it's important to try and tackle the damp as early and mould as early as possible, really. especially if you've got an allergy to the mould spores.
Sometimes I think, I remember when I was a child, I had damp on one of the walls in my room. And as we kind of discussed in previous sessions, that my asthma was quite bad as a child. And the problem was that it was behind my cupboard. So you couldn't actually see it. And I remember when they did kind of remove everything, remove the cupboard, it was actually quite bad. So sometimes it might be in places like you were mentioning, in walls and ceilings, and you might not be able to see it all the time. So even if you see like a little bit and you think, oh, you know, it's fine, actually there might be a lot more hiding behind, you know, things.
And in the second webinar, you actually discussed how you'd had a few asthma attacks and flare-ups.
Exactly.
It possibly could have even been related to the mould and the spores you were inhaling.
And we mentioned, like, you know, be quite careful if you're going to try and clean these surfaces, because I remember when they moved that cupboard, that did trigger my asthma because I was exposed to it more. And I couldn't even go into that room because I could actually feel myself, you know, struggling to breathe. You know, it was triggering, basically my asthma. You have to be, quite careful. And that smell, it's very like musty sort of smell that you get.
So you're much more alert now to those things.
Yes, So you mentioned there's certain places that could, you know, places in the house that could
just
kind of be worse.
Condensation,
bit more condensation in the house, certain areas. Now it is winter. Usually, you know, most of us dry our clothes outside. But as it gets cold, can't really do that. So we dry our clothes inside. Is that a problem?
It can be a problem. Sometimes, you know, if it's raining or you just can't dry your clothes outside. So people are resorting to drying it indoors. Again, as I discussed, the dehumidifier might be useful in that situation, but make sure you keep a window open as well when you're drying the clothes indoors. It's
a struggle, isn't it? I mean, you can get like tumble dryers and things, but and actually you notice in that as well how much water comes out. So actually that water is going in the air, isn't it, if you're not removing it.
Let's do a quick summary of everything we've discussed. So we know that mould is a type of fungus and it releases spores which you might be allergic to, and it can trigger asthma symptoms, as you explained in your story. Also, we discussed some top tips on the room,
what to do
in your house, and things that you can change.
Make sure, go look around in your house now after this webinar and go spot if you've got any mould, and we've given you some tips on what you can do, but get down to the root cause of the problem.
Exactly. Get professional help if you're unsure as well, or if there's significant damp or mould issue. So thank you for tuning in again, and we're looking forward to you joining us on the next webinar. And what's the next webinar's topic?
So we're going to look, so today I think we talked a bit about mould, which is one of the triggers, but we're going to go into a few of the other ones next week.
So we'll be discussing other possible triggers of asthma in detail. Thank you again. Bye-bye.